I teach the basic intro to epidemiology course, the HM 803, and it's just sort of an introductory level epidemiology course that I think is important for all public health officials or workers to take and to become better consumers of scientific information and understanding data in a very applied format. And epidemiology is my passion, so that's what I do. Actually, the other 4 days a week I work for the state health department, and I've had a lot of training in epidemiology and use it every day there. So it's very exciting for me to be able to teach that to students and use a lot of real life examples. So that's fun. And my outbreak investigation course is kind of a sort of the advanced sort of step beyond the basic epidemiology course. So that's where we actually use a lot of what you learn in epidemiology, the basic epidemiology course, and see it in more detail in a lot of different settings, different types of outbreak situations, and so it's more specific. It's not just infectious disease. There's a lot of different types of outbreaks that we work through, but what I try to emphasize is that the basic epidemiology you learn in the 803 course is essential to be able to pursue outbreaks and investigations and to try to solidify some of that skill set. I think having biostats ahead of time would probably help. There is a lot of math in the Intro to Epidemiology course, so if the math aspect is what tends to scare people when they think about epidemiology or pursuing that. So I think if you can sort of go through the biostats class and survive it, then you'll be in good shape to take the Intro to Epidemiology course. It won't be intimidating. The math aspects won't be. So that would be a recommendation if you want to make your own life easier. I have a variety of degrees. I'm a bit of a chronic academic, but I started out just very intensely wanting to go to veterinary school, and so my whole undergrad the focus was on to get into vet school, but I also wanted to do international health with my veterinary degree, so I had an undergraduate certificate in African studies, so I always had that kind of competing interest, and I could never figure out how to bring my international interest together with the veterinary medicine very well until I ran into epidemiology, and then I saw that was actually a very natural intersection. And then public health. And so even before I finished vet school, I knew I wanted to go on and get a master's in public health as an attempt to bring a lot of my interests together. And so I went to vet school here at Michigan State and undergrad, and then had to actually go out and get a job. And I worked for U.S. Department of Agriculture as a field vet, and then as an area epidemiology officer for USDA. And then worked on my MPH in the evenings, similar structure to what MSU is now offering. It's a program designed for the working professional, or otherwise you could be fully employed and still pursue your master's degree from anywhere in the world or in your pajamas at home. And so I found that type of program very valuable, and that's why I was excited to be involved in this program. And so I did get my master's in public health, and then immediately went from there into the EIS program, which is the Epidemic Intelligence Service program with CDC. And so that's a 2-year applied epi training program, which is a pretty hardcore program, but it's an excellent training opportunity. So I did that for 2 years with CDC, and then through that program you can either stay in Atlanta at one of the centers, or you can go and match to a state health department. So I went, and through the matching program ended up back in Michigan, and matched the Michigan Department of Community Health for my 2-year training program, and stayed on there on staff. So that was my transition from veterinary medicine pretty much all the way over into human medicine, but there's lots of crossover. And then eventually went back and got a PhD, and so again working full time. So it's sort of I've managed to have a pretty full career and pursue a lot of degrees at the same time. But again, it's the flexibility which is important, and that's, again, why I love this program. I can sympathize with the working parents in the crowd, definitely. So, but I stayed after EIS. I stayed on with the state health department and eventually moved up to where I am now, which is the director for Division of Communicable Disease. So and now I get to train the EIS officers as they come through, so it's fun. Well, my focus is communicable disease, so that's, where there's always something going on, some sort of foodborne outbreak, whether it's, a spinach or salmonella in spinach or E. coli in hamburger. There's always something that we're working on at the health department. Obviously, the pandemic flu that came through, the H1N1 2009 pandemic was huge. We'd been planning for a pandemic for years, and then it finally happened, just like it was supposed to. So that was, a pretty big year. 2009 was a big year for us. The flu was most of what we worked on. But, we always have outbreaks, big or small. There's always, always different issues of food contamination and recalls and so on. So there's no shortage of examples. And we're doing a lot of exciting work with developing new systems for collecting data and tracking. And, nowadays we track chief complaints out of emergency rooms, and we use that as a sort of early indicator that something large scale may be going on. And we track over-the-counter pharmaceutical sales. So again, trying to use existing data for to get an indication that something might be going on, even pre-diagnostically. So before we have lab confirmation, if suddenly every antidiarrheal in the state is purchased, then we would have a flag on that maybe there's a large-scale water contamination issue or something like that. So there's a lot of new exciting surveillance opportunities that the newer IT systems can offer to us, the new ability to share data. This field is changing very rapidly, and it's going to be important to keep up with the changes in the field so that the graduates will be competitive when they get out, and they'll have been exposed to the current technologies and the current situations. So, I think the basic epidemiology course will serve them well, no matter where they end up. Either as an epidemiologist or as a health educator, even in journalism, it will help you be a better consumer of public health data. The outbreak investigation course is probably geared a little bit more toward employment in local public health or state public health, because those are the bodies that have the authority to do the investigation. But I would also throw Department of Agriculture. They're close partners with us, and FDA in there as well. Obviously federal agencies, there's a lot of federal coordination. So I think public health at all levels would be good target employment places for the outbreak investigation graduates who have taken that course. So, one of the best examples, I think, is if you ever see U.S. News and World Reports, just that national newspaper, they always have little boxes of, charts and graphs and data, and they show something that's fairly startling or striking. And I think that if you've had even basic epidemiology, you would be able to look at that and critically say, oh my gosh, they, jiggered the x-axis or the y-axis to make it look horrible, when in reality you would know that it's not nearly as dramatic as they make it look. There's a lot of ways you can manipulate data, and if you have a better understanding of the fundamentals of epidemiology, then you're going to be able to be a much more intelligent consumer of data that most people, they're just going to accept it as is, but you'll be able to critique it and decide if it's a good source or not. So I think that's helpful. I think it's an exciting time. I think that public health is finally starting to get some recognition as as a very deliberate career choice. I think in the past it's something that people have sort of stumbled into, or you don't really find out about it until maybe you're already down one career path, and then you hear about it later. I think it's very exciting that it's being introduced as a career choice at the undergrad level, and then people are very deliberately choosing to go into public health, which is just a major shift in thought process. And I think it's a great opportunity, because we need young people, and we need people who want to actively choose this. So that kind of energy will be fantastic. So.